first, because we're waiting for people to show up, I just thought I'd start with my life story.
That's good.
That's about 3 minutes, right?
That's about 3 minutes, maybe 2. Born in Buffalo Center, Iowa, part of Iowa, northern part, halfway between Mason City and Spirit Lake, a 160-acre farm, oldest boy of 5 children. I was put in charge of running anything and everything when my father wasn't around, so I became somebody who knew how to tell everybody else what to do. My brothers and sisters still hate me, if you know that syndrome. Come on, boys and girls, let's go work. Dad told me either I get you to work or I'm going to get spanked or whatever. And so that's how I spent my first 18 years trying to get my brothers and sisters to work right alongside me. Anyway, that was kind of where I learned how to work. And my first experience with medicine was when I was 4. And we had these big draft horses back in the farm in the days when we didn't have tractors and all that. Some of you may actually remember those days. Yeah. I remember sitting on top of these monsters with my feet strapped like straight out horizontally because they were so big and I was so small. And anyway, one of those horses died, and so the vet came over to do an autopsy, and I said, "Dad, Mom, I want to watch this." And they told me, no, that was gonna ruin my life and my brain. And I said, well, it's my brain to ruin, so let me get in here and do it. And so I jumped in and not helped, but I actually observed, and even at one point I climbed inside of that horse's carcass, can you believe? And I was comparing the horse. I wanted to compare the horse with the tractor because I'd already learned how a tractor worked at that time because my dad had a tractor and had been working on it, showed me a little bit about how pistons worked and all that stuff. So I was saying, how does a tractor work and move and a horse does? And there's got to be some kind of connection. So I was kind of puzzling over that at 4. Anyway, so that was how I got into that. And with that and all the other things, I got interested in aging. And so aging was, and how to prevent aging was part of my early life. I got a full scholarship to the University of Miami in 1966 for my PhD in gerontology. After 3 or 4 months, I decided that studying aging was not the same as what I wanted, and that was that I thought that disease and pathology had something to do with aging, and aging had something to do with pathology and disease, and you couldn't separate the 2 or 3, but the professors I was dealing with thought you could. And so I quit that, went back to medical school, and because I was interested in pathology, they wouldn't let me study pathology there at the University of Miami. They wanted me to stay in physiology and boil rats or whatever. That was very boring. And so I went back to medical school, graduated with internship, etc. I went out 4 years of pathology training, anatomical and clinical pathology. So I wound up with having my master's degree in biochemistry, 4 years of pathology, a rotating internship, and I've spent, since 1978, I've been practicing alternative, complementary, integrative medicine, dealing with all chronic diseases and aging. I was president of the Aging Research Institute in 1983, and we have still that kind of a research institute. My facility is 15,000 square feet. I've got the state-of-the-art stem cell laboratory, a monster library. I've got more in one clinic than pretty much anybody else in this country, if not the world. If you ever come over to my place, we'd be happy to give you a tour. Chase here is my #1 right-hand man, and he's a great guy and a great personality, and he'd be happy to show you around and help you out and all that. So today, and by the way, I've also been specializing now in the last, I kind of go from every 10 years, I specialize in something different because I think that you need to keep your brain going. And so back in the 80s, I did general complementary integrated medicine, trying to just do anything and everything. Then and so a lot of that was cardiovascular disease, chelation therapy, that kind of thing. And then in the 90s, I did stroke and traumatic brain injury recovery and regeneration with hyperbaric oxygen. And we had the first hyperbaric oxygen facility in the world dedicated to treatment of stroke. And we had people coming from all over the world for that. for 10 years. We treated over 2,000 patients with a 2-month program. We had about a 95% success rate, and it was quite successful, but somewhere in there, a lot of my patients were still complaining. I'd get them out of a wheelchair, they'd be up walking, but they still would have a limp or whatever. They'd bitch at me that they wanted still more, and so I continued to look and found stem cells in about 2000 and started working with stem cells. And we had a book published in 2006 with our early work out in Mexico. We did a lot of double-blind studies down there. My first program down there was using stem cells, umbilical cord stem cells, for treatment of cerebral palsy. People ask me why, and that was the low-hanging fruit, still is. Cerebral palsy children are healthy, normal, other than having white matter damage. They have what's called periventricular leukomalacia, which is a particular kind of white matter damage that occurs at birth. And stem cells have a preference for going to white matter and fixing it, and we knew that from the rabbits and rats and all that. And so it was easy to think that maybe that would be the best kind of case, and it turned out it was. At that time, stem cells were selling for $21,000 a shot, and so we couldn't very well try to, I wanted to make sure that whatever we did was going to have the best chance of success with those kind of dollars. And so if one small vial of stem cells we had about 85% of our cerebral palsy children get better. Not cured, but better in many ways. And so I've had 5 children totally blind, now can see because of stem cells. So that's a pretty good evidence that stem cells have some pretty powerful things. We have, there's a lot of things we can talk about there. Anyway, so stem cells became part and parcel of my life, and my first stem cell lab was in about 2006 and 7, and we've had one ever since. I have all kinds of slides, but technology is what it is, and I got here last night and thinking that I could put all of this together. I've got hundreds, thousands of slides literally to show you. I have slides of my library, which is massive. It will just blow you away. It's like the Library of Congress, and Chase can attest to that. He gets lost in it. I keep trying to tell young girls, young beautiful women like you, to come over and I'll give you a tour of my back part of my library. But nobody wants to take me up on that one because it's such a massive place. So you can be, it's like, anyway. Anyway, funny thing. Anyway, we have, over the last 7 or 8 years now, I've been working on ALS, amyotrophic lateral sclerosis. I think I've come up with the cause of ALS, and I don't want to bore you with all that detail because it's complicated. Today we're going to talk about aging and how to stay young and healthy. I looked in the mirror last night and I said, why would anybody pay attention to me? Because I'm 75 and I probably look pretty much like it. And I was reminded that, looking at that bald head of mine, and I'm saying, there was this guy that was, his name, I guess I could mention he's dead and gone. His name was Dale Alexander. And he wrote a book that was the most popular book ever in the treatment of arthritis. It was Dale Alexander's Common Sense and Arthritis. He sold over 2 million copies of that book. And so he really was successful with that. And so a few years later, he came out with another book that he thought maybe would be just as successful. And it was How to Grow Hair. And he put his picture on the front cover, and he was balder than me. And he's putting on his book that How to Grow Hair, and he's put his picture as an example of how to grow hair. But he's totally bald. I said, Dale, what is that all about? He sold 4,000 copies. So all I'm saying is, when I have a full head of hair and I look like I'm 18 again, then maybe you really start paying attention to me when I start talking about anti-aging and younger. Anyway, here, okay, I've got the clicker in my pocket, if I can figure this out here. How do I do this? Let's see.
There you go.
Okay, so I've developed a little program now.
Younger.
So stem cells, now there are many kinds of stem cells. In this country today, we have, I have a lot of competition. And the competition is mostly amniotic stem cells. These are stem cells that people are buying from companies that are supposedly licensed to sell amniotic cell membranes for wound healing. And so what they're doing is telling the doctors, well, since we've got a license for this, then we can sell you stem cells because of that license. And they're using that as a way of convincing the doctors that what they're doing is all legal. In fact is, everybody out there that's using umbilical cord stem cells, amniotic stem cells, they're all committing whatever. It's all illegal. FDA does not approve any of it. And the only thing is that they're getting away with it because apparently the FDA's got so many other things to do that they're not concerned too much, and we haven't seen too much damage from it in terms of those cells. So in any case, when you have your own stem cell lab, it's a whole different world. And I had pictures of my flow cytometer, which is the device that you measure stem cells with. That's a $130,000 machine. Your general doctor, your plastic surgeons down the street, they don't have anything like that. They have no clue. Most of them don't even have a microscope. And if you're going to go to one of those doctors, you want to say, did you look at it under your microscope? Because within that material, there's all kinds of chunks of tissue. Because what they do, these companies are taking placentas and amnions and the umbilical cord and grinding them up, putting that ground up material into the vials and selling it to the doctors because it's a very profitable business that way, but it's not pure. So you get all these chunks of tissue, and so you never want to let anybody other than somebody who's really got good quality control give you any kind of an injection, because those particles of material can go to your lungs and cause pulmonary emboli and give you some real problems. So anyway, so the point was that you want to make sure that you get good stem cells. The stem cell costs about, right now, overall $3,000 to $4,000 or $5,000. We're selling them for $3,000, which is better than what those amniotic companies are selling anyway. And so in this program, now stem cells, just by the way, you can use them for all kinds of things. Everybody knows all about stem cells, or should I just spend 30 minutes about faster? Okay, you know all about it. But everybody's okay with, we have an umbilical cord. Out of the umbilical cord, you have CD34s, which are your standard hematopoietics. You have mesenchymals and stromals and all that kind of stuff. So all of those things are, then you have your bone marrow, you have your fat, all these things are available. And now I coined the word youngering because nobody else had, and I think it's quite self-evident what that means, and it's a process of trying to make ourselves younger. We're trying to make ourselves younger, right? Otherwise we'd be sitting in the front row, right?
That's right.
You can do a little or a lot. Some people come once a year. This is a new program, so that's the idea. You come and spend one day, and it consists of, this program right now is, it's on a one-day program. You first of all have intravenous ozone, and we're going to go over a little bit about that. Then chelation with sodium EDTA. Then you get your intravenous stem cells. Then you have the external counterpulsation therapy to help push the stem cells into the tissues. And then you have my little invention of what I call stem cell redo, which is basically a combination of functional electrical stimulation of the bone marrow, intermittent hypoxia or high altitude training, 5 minutes at high altitude, 5 minutes at sea level, back and forth for an hour. And then during that same time, you get, your whole body is irradiated by 730 nanometer red light, which activates the stem cells. And so it's this combination of things that really enhance the effectiveness. Now, the reason why I do that is because of the fact that when you just give stem cells to a person who's normally healthy, you don't see much result. And the reason for that is that when the stem cells are injected, they first go to your lung, and they're trapped in the lung for the first 24 hours, and then after that they spread and go to the spleen and liver, and then slowly wander around the whole body. But if there's no weakness, no damage, there's no place to go. They need a place to roost. Stem cells need to be attracted to something, just like men are attracted to women. We need to have a pretty girl, and then we're attracted. And so if we don't have those things to attract us, we don't know what to do. We sit around, drink beer, and talk. So you need those kinds of things happening, and so this is a process of helping do that, helping the stem cells figure out what to do and how to do it, and get them into your tissues. So first of all, we have this intravenous ozone, which is not just straight shot, but it's you take that and mix it with blood and whatnot, and put that back into the system. That's a stress on your whole body. Now, I didn't put there, but if you're healthy enough, in there too, I put you in a vibrating device of my invention that shakes the bejesus out of you. And again, that's to any part of your body that's a little bit weaker than other parts is going to be aggravated by that vibration. And so that vibration helps cause an immediate effect on your system, which weakens it a little bit so that the stem cells have a place to go to fix. So we're trying to identify any weak blood vessels in your system where these cells can go. And then we have, then chelation is disodium EDTA. Disodium EDTA is a very great substance that has not been researched enough. I started doing chelation in 1977. I've done thousands and thousands of treatments. I taught chelation therapy to doctors for 10 years about the side effects, pathology of it, and whatever, until they fired me because I was telling the truth, and the doctors at ACAM did not want to hear the truth about the dangers of EDTA, because it can be dangerous, but if you know what you're doing, it's quite safe. In any case, the disodium EDTA binds calcium, it binds zinc too, but the one that we're concerned about here is the fact that when you take out enough calcium, the gap junctions of the endothelium are going to be weakened, and that weakness then of the endothelial cells of your blood vessels will allow the stem cells to get through the blood vessel into your tissues. And so after we do that for 3 hours to weaken your whole system, so we've done 2 or 3 things to weaken your system, and then we give you the intravenous stem cells, so the stem cells then have areas of the body to go to. And after that, then we use this counter pulsation to actually shove the cells further into the tissues too. And then after that, then we have, now that they're in the tissues and whatnot, then we try to activate them by using this combination and release more stem cells into your system. So that's kind of a one-day program.
Hey, Doc.
Yeah.
It's impressive. That's an amazing one-day program.
Yeah.
That's amazing.
Yeah, and it really works. I've got some pictures of people before and after. It's amazing. It's like 10, 15 years of, improvement without any facelifts or anything. Now if I could just figure out how to make this thing work.
Just keep pushing.
There we go.
There you go.
Now, other methods. Now, I said, okay, that's great, but how about, what other things have I discovered? So I thought I'd just spill my guts here and tell you all the secrets that I know. I've worked on this. Now, HLA, everybody knows about HLA matching for transplants, and you can actually I can take your blood. Unfortunately, it costs $2,000 to do an HLA match, and I figure out what your HLA is, and then I shop it around to all the umbilical cord blood banks and see if I can find that HLA matched cord blood, get that, buy that, and then I take that and grow that, and then I can give that back to you. Now I can just give it back to you as an IV, but that is not what I'm talking about here. What I'm talking about here is actually making you have your whole body is now changed, and so that by putting a whole bunch of these HLA matched umbilical cord blood stem cells into your own bone marrow, the bone marrow is where these things grow anyway. So we're just taking taking your blood, putting it into your bone marrow, but they're now not your age, like you're 60 or 50 or whatever. Well, no, now these are brand new, just born cells. So these cells are 1,000 times stronger in terms of regeneration than what you have right now. So these become permanent in your bone marrow, and they stay there forever. And so that's a very good source of upping your growth factors and whatnot, which is available. Another method is another more simple technique, and that's just repetitive bone marrow transplants. I discovered this about 2007 or so, and I would have these old folks come in who were like 85, 80 years old, and they looked like death warmed over. And I would do a bone marrow today, and then 2 weeks later do another one, and 2 weeks later do another one, and 2 weeks later do another one. What happened was you could actually see quite well the changes in that person over that, like it was like 6 weeks, 2 months type of frame. The skin would clear, it would become more hydrated, they would be feeling better, their aches and pains had disappeared, and you could actually, if you took pictures, you could see quite well that they had gained like 10 extra years of life from the way, at least the way they look. So bone marrow transplants have that's a very simple, easy way to do, to get a good anti-aging effect. Now, if you combine that with TA65, I think you get better results. Now, that's a good point to stop and talk about TA65 a little bit. I sell a little bit of it, but it's not a big money maker. But the point of it is that it does do something in terms of telomeres or whatever. And I had just a sidebar of a couple, a man and woman. He was 80, she's 79. He was healthy and doing well up until about a year before, and he started to get the dwindles, and he had become basically a couch potato. He was sleeping all the time. He was unable to function. He was unable to work, and basically the family thought he was just dying, and so the son, I believe, found out about TA65 and bought some, gave his parents the TA65, and they'd been on it for a month or two, and they came in to see me, and they said they wanted to do a bone marrow transplant. And I told them, well, forget it, 80 years old, there's just no way. I've not seen anybody get better with a bone marrow at 80. Your bone marrow is not too good. And they said, well, it's our money, we want to do it. I said, well, don't forget, I told you it's not going to work. And so we did it, and within like 2 weeks after the bone marrow, this 80-year-old that was a couch potato was back fully active, fully working, just like he'd never had any problem, just like he was 20, 30 years younger. And I said, well, damn, this is exciting. So I took that TA65 to the lab, and I tested it in the lab, and sure enough, it really helps the stem cells grow in the lab too. And so I said, okay, well, that's enough for me. So we've been using TA65 ever since then as part of our helping people, because it works. So it's expensive, but it works.